Hello, my name is Kristen Prelip, and I'm the Public Information Officer and Communications Manager for the Orange County Health Department. Welcome to the third episode of Public Health Chat. In each episode, we will meet some of the wonderful people who work in public health and will explore a variety of topics. We are joined today by the Orange County Health Director, Quintana Stewart. Quintana, if you would, please give us a COVID-19 update for Orange County, North Carolina.
Sure. So as of today, we have a total of 4,215 lab confirmed cases here in Orange County. Over the last 7 days, we've had 246 new cases. This means that we're averaging about 35 new cases per day. As of today, we've unfortunately also had 62 COVID-related deaths here in the county. As we review some of our key metrics for Orange County, the data shows that we are headed in the wrong direction. As I mentioned moments ago, our case count is trending upward. Cases have steadily increased since mid-November, with noticeable increase over the last week. Our percent positive of all tests conducted has also increased. As of test data through December 6th, our percent positive is around 5.1%. The goal for this metric is really 5% or less, so this indicates an increase in community spread of the virus. We continue to see positive cases that result from social and family gatherings. As anticipated, an increase has occurred as a result of the holiday. Our hospitals are also feeling the impact of this surge of cases. The number of COVID-like illness ED visits has increased, as well as the number of hospitalizations for COVID-positive patients. This is traditionally a busy time for our hospitals as they deal with cold and flu season. This year, however, they are also treating COVID-19. Yesterday, Governor Cooper announced Executive Order 181, which outlines a modified stay-at-home order. The order requires people to stay at home between 10 p.m. and 5 a.m. That will be effective this Friday, December 11th at 5 p.m. The order will remain in place at least until January 8th, 2021. The governor explained that the order aims to limit gatherings and get people home where they are safer during the holiday season. The Department of Health and Human Services also shared the updated COVID-19 County Alert System report yesterday. Over the past 2 weeks, there has been a rapid increase of COVID cases statewide. The alert system uses a 3-tier approach to categorize counties based on key metrics that indicate levels of viral spread. Because no one metric provides a complete picture, the system looks at the percent positive tests, hospital impact, and case rate. Yellow indicates significant community spread, orange indicates substantial community spread, and red indicates critical community spread. Orange County continues to be in the yellow tier. At this time, our case rate, percent positive, and hospital impact has not met the threshold for substantial or critical community spread. However, I caution everyone that our data suggests that we are headed in that direction. So it is so important that we all continue to practice the 3 W's. We know it works, and we've been able to slow the spread of this virus before by doing these important things. Wear the mask, wait 6 feet apart, and wash your hands often. If we continue this and adhere to the new stay-at-home order, we're that much closer to really turning things around here in Orange County. Thank you all for everything you've done and sacrificed over the last 9 months. Each passing day gets us one day closer to the end of this pandemic. I just beg you, stay the course. We are going to get through this and on the other side of this pandemic.
Thank you for that update. Now let's discuss the COVID-19 vaccination plan. Quintana, it is very exciting that there are 2 COVID-19 vaccines that are nearly 95% effective in preventing COVID-19 with no safety concerns. Can you tell us about the vaccination plan for Orange County?
Sure. In fact, this is kind of a bright spot of my day these days, is going to the planning meetings to talk about vaccination. So a tested, safe, and effective vaccine will be available to all who want it, but supplies will be limited at first. Although the vaccines were developed quickly, They were built upon years of work in developing vaccines for similar viruses. Independent state and federal public health advisory committees have determined that the best way to fight COVID-19 is to start with vaccinations for the most at risk, reaching more people as the vaccine supply increases from January to June. So when a COVID vaccine is available for the general public, the Orange County Health Department will implement the plan to ensure that vaccine is distributed equitably and efficiently to county residents. To help determine who should get the vaccine first, the North Carolina Institute of Medicine convened an independent COVID vaccine advisory committee. The prioritization plan is based on the committee's guidance, along with guidance from the National Academy of Medicine on equitable distribution of vaccine. Initial phases will concentrate on the most vulnerable and high-risk populations, including long-term care facilities, first responders, healthcare workers, and others involved in treating COVID patients and administering the vaccine. Vaccines could be approved and administered as early as mid-December for this initial phase.
I know that the vaccine development has been coined Operation Warp Speed due to the urgency of the vaccine. Does this mean that corners were cut or that it's not fully tested?
No, more than 70,000 people participated in clinical trials for the two vaccines to determine if they are safe and effective. To date, the vaccines are showing over 90% efficacy in preventing COVID-19 with no safety concerns. COVID-19 vaccine must go through and pass clinical trials just like other drugs and vaccines.
Okay. And who will get the vaccine first, and what is the plan to vaccinate all who want it?
So those who need the vaccine most will get it first. As I said before, vaccine will be limited in the beginning, but everyone that wants it will be able to get the vaccine for free. The best way to end the pandemic is to vaccinate those most at risk, then vaccinate more people as the vaccine supply increases throughout 2021. The vaccine requires 2 doses a few weeks apart. The vaccine will be distributed in 4 phases. And so I'm going to attempt to go through each of those 4 phases in great detail. So, phase 1A, this includes every healthcare worker at high risk for exposure to COVID-19. That includes doctors, nurses, and all who interact and care for patients with COVID-19, including those who clean areas used by patients and those giving vaccines to these workers. The first phase also includes long-term care staff and residents, as well as people in skilled nursing facilities and in adult, family, and group homes. Phase 1B, this includes adults with 2 or more chronic conditions that put them at risk of severe illness as defined by the CDC, including conditions like cancer, COPD, serious heart conditions, sickle cell disease, and type 2 diabetes, among others. This phase will also include adults at high risk of exposure, including essential frontline workers such as police, food processing, plant workers, teachers, healthcare workers, and those living in prisons, homeless shelters, migrant and fishery housing who have 2 or more chronic conditions. Those working in prisons, jails, and homeless shelters, regardless of their chronic conditions, will also be vaccinated in phase 1B. So phase 2 will focus on adults at high risk for exposure and at an increased risk of severe illness. This includes essential frontline workers, all other healthcare workers not in 1A or 1B, and those living in prisons, homeless shelters, or migrant and fishery housing without chronic conditions. Adults age 65 and older will be vaccinated in phase 2, as well as adults under 65 with 1 chronic condition that puts them at risk of severe illness as defined by the CDC. Phase 3, this includes students and critical industry workers. This also includes college and university students, K through 12 students when there is an approved vaccine for children, and those that are employed in jobs that are critical to society but are at a lower risk of exposure. Phase 4, this is for everyone else who wants a safe and effective COVID-19 vaccination. They will be eligible in this final phase. You can read more about the phases from the North Carolina Department of Health and Human Services at https:// covid19.ncdhhs.gov/vaccines.
Excellent. All right. Well, I have another question. I have read news reports that some people who participated in the vaccine trials felt ill after they got the vaccine. Can you tell me more about that?
Sure. So, similar to the flu vaccine, some people may have temporary reactions after being vaccinated, such as swelling from the injection site, tiredness, or feeling off for a day or two. This feeling is actually a good sign, as it means that your body is mounting an effective immune response to COVID 19. The vaccine imitates the infection so that our bodies think a germ like the virus is attacking. This creates the antibody defenses we need to fight off COVID 19 and if and when the real germ attacks. All patients will be given patient education materials at the time of their vaccination, so they will be prepared for these mild side effects. The important thing to remember is there is no COVID 19 virus in the vaccine. I think that's worth repeating. There is no COVID 19 virus in the vaccine. The vaccine imitates the infection so that our bodies think a germ like the virus is attacking. And again, this creates the antibody defense we need to fight off COVID 19 if and when the real germ attacks.
Okay, that helps. Thank you. So, how will the Orange County Health Department ensure that this vaccine is distributed equitably?
Right. So the North Carolina COVID-19 vaccination plan has guiding principles um, that build on the foundation of the state's overall goals and pillars of response to this pandemic: prevention, testing, tracing, isolation, and quarantine. North Carolina took early and aggressive action to slow the spread of the virus, built statewide capacity for testing, PPE supplies, and contact tracing, developed hospital surge plans, and promoted aggressive prevention strategies. The guiding principles of the vaccination plan include all North Carolinians have equitable access to vaccines. Vaccine planning and distribution is inclusive, actively engages state and local government, public and private partners, and draws upon the experience and expertise of leaders from historically marginalized communities. Transparent, accurate, and frequent public communication is essential to building trust. Data is used to promote equity, track progress, and guide decision making. An appropriate stewardship of resources and continuous evaluation and improvement drives successful implementation. So not only is the state's vaccination plan, built on those guiding principles, our local Orange County vaccination plan follows suit and does the same thing.
Excellent. Okay, one last question. After I get the vaccine, which I'll be very glad to do I still need to wear a mask and practice social distancing and hand washing?
Yes, 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 and yes. I will tell you, after the vaccination process, we are still encouraging any and everyone to continue to practice the 3 Ws. Vaccination is just yet another tool in our box to fight the COVID 19 virus. So, yes, even after vaccination, we will still need everyone to wear the mask, socially distance, and continue to hand wash. Practice the 3 Ws.
Okay. Will there ever come a day that we don't have to practice the 3 Ws?
That's a good question. And maybe that will be the case. But I think we have a ways off before we're able to see that. But I would also say, my public health mind, that this is not a bad thing that we've now institutionalized the 3 Ws and made it common practice. I think we'll see great reward from doing this as we look at cold and flu season this year, because that will also limit, those respiratory viruses that also are transmitted. So I don't know. I could be in favor of us keeping the 3 Ws around for a while.
Yeah, it's nice to not get sick with a cold.
That's right.
All right. Well, I want to thank you for your hard work during this pandemic and for your leadership and for participating in this public health chat today. Stay safe and healthy, everyone. Goodbye.
Bye.
How to gather safely. Whether it's for a cookout, to celebrate a holiday, or any other reason, we all love to get together with our friends and family. The safest way to gather is to visit virtually. And it is safe to celebrate with your household members. If you do gather with non-household members, keep it small. Gathering limits are 10 indoors and 50 outdoors. Keep it outdoors. Outdoor spaces are better ventilated. Wear a mask. Masks are proven to slow the spread of COVID-19. During the pandemic, it is best to stay at home as much as possible. When you do go out, be sure to remember these 3 important things. Wear a cloth face covering, wait at least 6 feet apart from others at all times, wash your hands often or use hand sanitizer. Remember that household and family are different. Your household are the people you live with. Together, your household makes up a germ bubble. Household equals germ bubble. Family and friends who do not live with you have their own germ bubbles. Wear a mask and stay 6 feet apart from other households. Have fun safely.